Good morning, good morning. This is Marie Holiday, and I hope everybody's having a fabulous Sunday morning. And before we get started, I just want to remind the audience to hit that subscribe button and hit that notification button so you can be notified of ongoing uploads. And also do not forget to share my channel with someone in your household, especially if you are a loyal follower and subscriber. This channel is absolutely nothing without my viewers and subscribers. You gotta hit that subscribe button. So with that being said, let's get down to the next exciting lecture. The focus of this lecture, and I've been wanting to do a lecture on this for a while now. The focus of this lecture is going to be the COVID-19 pandemic and the rise in substance abuse. As the audience is aware, I'm a licensed clinical addiction specialist, and I've been in this field for over 21 years as a credentialed expert. So I'm going to present information from the treatment perspective based on my observation in the field in terms of what we in the substance abuse field have seen in terms of the rise of substance abuse because of the COVID-19 pandemic. And what we are seeing in treatment programs, first of all, foremost, is that people are starting or increasing substance use as a way of coping with stress or emotions related to the COVID-19. Pay attention now. You notice I said people are starting or increasing. For example, because of the COVID-19, we're seeing an increase in emotional stress, anxiety, depression, loss of job, income, adjustment in livelihood, people not being able to pay their bills, rent, mortgage, car note, food, cell phone bill, etc. They're not able to provide for their kids because of loss of income from the COVID-19. Some people have lost everything, have lost their home, lost their business, fear of eviction, being evicted, all of this that's been going on in relation that is a direct link to the COVID-19 pandemic. So what we see as an addiction expert, what we have seen now because of the COVID-19 pandemic, what we have also seen in the field of addiction is an increase in addiction overdose has spiked since the onset of the COVID-19 pandemic. Some people, since the onset of the pandemic, have started abusing alcohol for the first time. Have started abusing alcohol and have also started experiment with other drugs for the first time since the onset of the COVID-19 pandemic. People who historically never were using marijuana, cocaine, methamphetamine, opiates, Xanax, have for the first time begun to experiment with these drugs and become addicted to these drugs since the onset of the COVID-19 pandemic. There's an increase in stress. We all know that increase in stress can lead to an increase in alcohol and substance use. There's a direct correlation, and I'm here to tell you. So there could be someone who's listening to this video upload right now who has increased their substance use or started abusing alcohol and experimenting with drugs. So if you or someone you care about is starting to use alcohol or other substance, or is increasing their use of alcohol and substances during the COVID-19 pandemic, here are a few suggestions. Here are a few examples or suggestions that can help someone in this situation. So pay attention. Please contact your local healthcare provider. Also, locate virtual treatment and other recovery programs as a second suggestion. Number 3 suggestion, continue your therapy and treatment or support appointments in person or through telehealth services when possible. Number 4, also there's a lot of 1-800 numbers out there where you can call to speak to someone about your alcohol and substance abuse, and those 1-800 numbers can be utilized as a resource. Number 5, don't forget support of family members, loved ones, your sponsor. Number 6, and I'm going to just put this out here, which is very, very important, especially in relation to if you lost your job or lost your income, you can't pay your bills, hit the pavement. Tap into your resources for jobs. I'm here to tell you, even with the COVID-19 pandemic and before, there still are a lot of jobs out there. There have been also a lot of jobs that have been created because of the COVID-19 pandemic. So, don't use this as an excuse, ladies and gentlemen, if you lost your job because of the COVID-19. There still are a lot of jobs out there. There still have been jobs that have been created because of the COVID-19 pandemic. Construction jobs are on the uprise. Security jobs are on the uprise. Warehouse jobs and production jobs are on the uprise. Assembly work jobs are on the uprise. Hospital jobs are on the uprise. Amazon jobs and UPS jobs are on the uprise. And I'm here to tell you, because a green dollar is a green dollar. There are a lot of jobs out there. Hit the pavement, tap into your resources, because I'm gonna just throw this out here. There are some people out here in this world, because of the COVID-19, have used that as an excuse not to work, want to just get the free money and the unemployment and what can be handed out to them. But I'm here to tell you, if you're self-driven and motivated, there were a lot of jobs out there before the COVID-19. There are a lot of jobs out there now since the onset of the COVID-19. And if you're about your business, you can get out there, get a job, get you a part-time job, a full-time job, and reclaim your livelihood. I'm here to tell you, because there are jobs out there. But unfortunately, there are a lot of people who were lazy before the COVID-19, just want handouts. So, and for people who truly have lost their jobs, I'm here to tell you, because I'm in conversation with people from all walks of life. I know many people who lost jobs and went out there and got them another job, got 2 jobs. There are jobs out there. I'm here to tell you, it might not be what you want, but it can be something to keep a roof over your head and take care of your kids. Because at the end of the month, the bill collectors, all they want to know is, can you pay the bill? They're not really interested in what kind of job you have, because at the end of the month, a green dollar is a green dollar to be able to pay them bills and to feed your kids and to keep a roof over your head. And I'm here to tell you. So there are jobs out there. I'm here to tell you, they're out there. They were out there before the COVID-19. And I'm here to tell you. So ladies and gentlemen, that's all I have. This has been a topic that I wanted to touch bases on, since the onset of the COVID-19 pandemic. And please do not forget to hit my subscribe button, share my channel, hit that subscribe button, pass this channel on, pass this information along from someone who may be able to benefit from it. And with that being said, Semper Fi, Semper Fidelis. I will see you all again next time, and I'm going to leave you in the care of your own conscience.